In the forearm of the upper limb, we find two long bones, laterally the radius and medially the ulna. If we take the right radius and ulna and start by looking at the anterior view, we can see that at the proximal end of the radius is the head of the radius. This is the articular portion and articulates with the humerus proximally to form the elbow joint, and it also articulates with the adjacent radial notch of the ulna to form the proximal radio-ulnar joint. We have a similar arrangement at the distal end of the radius and ulna. This time we have the head of the ulna articulating with the ulnar notch of the radius, and together they form the distal radio-ulnar joint. As we progress distally along the radius, we find a bump known as the radial tuberosity, which is the site of muscle attachment for the biceps brachii tendon. We have a similar bump on the ulna known as the brachialis impression or ulnar tuberosity, and this is the site of attachment for the brachialis tendon. At the proximal end, we have the trochlear notch, which is the site of articulation for the humerus and also contributes to the elbow joint. As we move along these long bones, they both have a shaft, which is where the interosseous membrane attaches between the two bones. And finally, at the distal end of both bones, we have a styloid process. If we look at the posterior view of the ulna and radius, there is a very prominent projection of bone at the proximal end of the ulna called the olecranon, and that forms the point of your elbow. If we have a closer look at the articulations formed at the proximal end of the radius and the ulna, we see that it's the capitulum of the humerus that articulates with the head of the radius, and together they form the humeroradial part of the elbow joint. On the medial side, the trochlea of the humerus articulates with the trochlear notch of the ulna to form the humero-ulnar component of the elbow joint. The elbow joint is classified as a synovial hinge joint and is responsible for flexion and extension, which allows shortening and lengthening of the upper limb. Sharing the same joint cavity, but forming a very different joint which has a different function, is the proximal radio-ulnar joint. And this joint is formed between the head of the radius together with the radial notch of the ulna. And together they form a synovial pivot joint which allows pronation and supination of the forearm to occur.